Kia ora, my name is Carrie and I'm an advanced trainee registrar at Public Health Medicine. I train under the New Zealand College of Public Health Medicine and I'm currently based in Auckland, and the college itself is based in Wellington. My desire to go into public health probably stems from my involvement with my community. So at a young age, I lived with a range of different families, and I noted that for many of my people, they were not actively seeking healthcare when they needed it. And so I started to become an advocate within my own town and trying to prioritize health and looking at ways of increasing healthcare access for my people. From there, my community supported me to become a doctor. And so after completing medical school, I returned home to Northland, where I began working as a health officer at Whangarei Base Hospital. So it's like a junior doctor at the Whangarei Base Hospital. But it didn't take long for me to realise that hospitals are essentially a revolving door. And I was seeing the same people time and time again, and I started to ask the but why questions. So why did this person have this disease? And I began to link the preventable causes to these presentations. At the same time, I also started to wonder, where are those people that were not accessing healthcare? And so long story short, I soon realised that personally, my career as a doctor could not just start when people arrived through the hospital doors. I wanted to make a difference before it got to that point. And so I journeyed into public health medicine. So what's exciting about it? Well, once you begin your journey into public health, the things you learn cannot be unseen. I usually describe public health as like a really good pair of sunglasses. So it takes all the glare away and suddenly all the health-related problems become very clear. You're essentially looking at health through a new lens. And the answers to the but why questions I had now became very apparent. And so I describe public health as not something that can be learnt from a textbook, but rather it's a series of connections, and you make this connection between understanding politics, historical influences, infrastructure, colonization, climate change, and like emerging diseases, just to name a few. Aside from the broad level of learning that you get, I also feel like I'm finally making a positive change, and that's at a big level. So public health isn't about working with individuals, rather it's about making change at that population level. I like to think of public health as seeing things from like a helicopter view. And so we kind of hover above, and then when something appears that needs our attention, we come down and land for a short while, and then we come back up again. And these things are ever changing. So in terms of what I've been working on, I've had some experience learning and working with the Auckland team on the recent measles outbreak. And now I've shifted working into, and some very fast learning into the COVID-19 response. Aside from these responses, I also am undertaking a environmental health project looking at the climate and to see whether certain weather events are linked to a certain lung condition called Legionella. The theory is that certain temperatures can create a Legionella growth, and then when you get a big heavy downpour of rain, it could potentially lift it up into the air, and then we can inhale it into our airway and get Legionella disease within the population. So that's what I'm working on at the moment. So why should you consider doing public health? Well, put simply, you should consider public health medicine if you want to become a leader in positive and equitable change at the population health level. You should consider public health medicine if you want to be the detective and work on preventing problems before they occur. And finally, you should consider public health medicine if you want to become a part of a dynamic, growing area that's broad in learning, innovative, and supports your creative thinking. Kia ora.